Hello everyone and welcome to this video for the protocol of Boostlingo. Today we will be shortly looking at how the protocol works for Boostlingo and yeah, it might be different for some of the companies, but overall this is the protocol that has been used for taking calls while using the platform. Uh, as an interpreter, you might have some knowledge, or you may be new, you don't have any knowledge about how it works, but we will definitely guide you. If you have any question, please let us know. Let's start this video. Firstly, we will be talking about opening and closing statements, how it works. So whenever you're receiving a call, it rings, you have to introduce yourself. Hello, my name is, for example, Jose. My ID number is, for example, 123, and I will be, for example, Portuguese interpreter. How may I help you? So three things are really important. You have to mention your name. You have to say that really well. Secondly, you will be provided with the number which is for the bill account, so you will be receiving a number, you will have an ID, which is interpreter ID we call it. And similarly, you have to specify the language that you're interpreting, because sometimes we receive calls, they choose a wrong language, so we should specify it at the beginning that I'm interpreter for this language. So it's quite simple. You greet, you should mention your name, your ID, your language, and at the same time you ask for what you can do as an interpreter. It's quite important that you should answer the questions for the client intake. Uh, Basically, this is quite important because sometimes if you're not getting the information for the intake, so it will cause a lot of damage, so it will cause a lot of issues for the financial department of the organization. And also it's probable that you're not paid for the minutes that you have worked as an interpreter. So it's quite important all the time to write down all the information that's needed for the client intake. So we'll talk about client intake. It's a different part. You receive a call, there will be a form, a series of questions might be there, so you have to write it down. Some of them are important, you must answer those questions in order to proceed and provide the services, the interpretation services. Some of them cannot be, like, it's not compulsory, you can just write there NA. So by the end we have a little bit information about the intakes as well. We will talk about it. Something that's optional for the over the phone interpretation and video remote interpretation, so OPI and VRI. If you receive a call, you introduce yourself here, right? And this is something optional. Okay, if you have time, you can also go after your introduction. You should also say that I will be interpreting everything. That is it. You're making a commitment. You make a promise to them that everything is said between the parties, the client and the LP. You will be interpreting that. And the second thing is, I will maintain confidentiality. It means that you're not expressing the information, you're not showing the information to anybody else. So the information discussed, anything discussed between client and LP, you will be keeping that confidential. Once again, client is the English speaking person, LP is the limited English proficient, someone who doesn't understand English, and they need your interpretation services. The third thing that we always say is, please speak to each other directly. This is something important. We ask them to speak to each other directly. It means, like, sometimes the doctor says, like, okay, interpreter, tell her that I will give you some medication. So this is like indirect way. You ask them to speak to each other directly. The doctor should say, I will give you some medication. As an interpreter, you will have to interpret, I will give you some medication. As this is one of the principles of the interpretation, that we should not interpret in third person. We have to use the first person pronouns, and we have to say this. The patient says, I'm sick. The patient has to say, I'm sick. The patient should not say that, interpreter, tell the doctor I am sick. This is not direct way, it's indirect way. So all the time, remember, you have to ask them to speak to each other directly. And the final one, I will interpret. Okay, sorry. I will interrupt if I need you to pause so I can interpret. Sometimes they speak for long, minutes or long time, so we can interrupt them whenever there is a pause. We can interrupt and we would say that, okay, let me interpret what you mentioned, and then we will move on. So it's quite important after you introduce yourself. It's quite important that you have to mention this one as well, even though it's optional. But I strongly encourage you. You can use it. I will interpret everything that is said. I will maintain confidentiality. Please speak to each other directly. And the last one, I will interrupt if I need you to pause so I can interpret. To the LP is the same thing. You have to introduce yourself. in the LAP's language, so you can say my name, and if you don't mention your, ID and your name, that's okay, no problem. Just you should say that I'm your interpreter for this language, for example, for Portuguese. And you can also say this to the LAP in their language. So let me give you a version of English. I would introduce myself to the LAP as hello, my name is, for example, hello, my name is Jose. I am your Portuguese interpreter. I will interpret everything that is said. I will maintain confidentiality. Please speak to each other directly. I will interrupt if I need you to pause so I can interpret. One thing that's important here, as an interpreter, whenever I introduce myself to the client, to the English speaking person, I have to mention my name and also the ID because they will keep it in the record. But if it comes to the LEP, okay, for the LEP, they don't need to record anything. We do not mention the name and we do not mention the ID. We just simply say hello, the language interpreter. Okay, if you mention your name, that's okay, no problem. But do not provide you an ID because your ID is not something that's needed by the LEP. And introduce yourself and also mention this to the LAP in their own language. If the LAP speaks Portuguese, Spanish, and Arabic, any language, that's okay. Same thing happens to the opening to the LAP. You have to say it. Now we come to the closing for the calls, if it's an audio OPI or it's on the video like VRI. So at the end you have to mention you understand now the session is about to finish and your assistance is not more needed. You have to say this. Anything else I can assist you with? Is there anything else I can assist you? Or for example, is there anything else for the interpreter? So they definitely say yes or no. Okay, in case they say no, you have to say thank you. Portuguese interpreter ID 12345 is disconnecting. For example, thank you. Spanish interpreter ID number 123 is disconnecting. This is about the opening and closing statements for the BL account. As I mentioned before as well, that for first person interpretation is quite important. Always remember, we have, as an interpreter, we have to interpret in first person. We cannot interpret like in second person, he says or she says. You cannot say that whether it's in English or it's in the target language that you are interpreting for. It's quite important. All the time you should use the first person pronoun. But there are some cases, like if there is someone is having mental issues, they do not understand. So in this case, you can say he says or she says. Or for example, if there is a child who doesn't understand something clearly, you can use an he says or she says. Or for example, there is a mother who talks about the child, that my child, for example, the patient says that my child doesn't eat well. So then you can say he doesn't eat well. So this time he refers to that child. It's not about the person, the mom, who speaks. So this is also really important. All the time try to use the first person pronoun. Do not say like he says, she says, neither in English language nor in the target language. For the intervention protocol, sometimes it happens that we need repetition, we need clarification, sometimes we need spelling of some words even, because this medical interpretation is not, all the time like a piece of cake. We have to pay attention to it. So in case you need someone for repetition all the time, remember, all the time, you have to specify yourself. Like, excuse interpreter, excuse me as an interpreter. Or for example, this is the interpreter. Okay, now this is a question that why I have to specify myself. Excuse interpreter. The thing is, like while we are interpreting, we communicate. We break the barriers to the communication between the LAP and also to the client. It's quite important that whenever we speak on our behalf, we need them to repeat. We need them for clarification. We need them, for example, to spell it out so we can search a word, a term, something that we are not familiar with. It's quite important we specify ourselves. We say, this is the interpreter speaking. Excuse the interpreter. Excuse me as the interpreter. We specify that this is the question not from the LAP side. It is from my side as an interpreter. For example, I need the provider to repeat something to me. In this case, I say, excuse the interpreter. May I ask you for repetition? Why specified myself? Because this repetition is needed by the interpreter, who the interpreter is me. Okay, it is not the LAP. But if the LAP says that I didn't catch it, could you repeat it? We have to say the same, I didn't catch it, could you repeat it? But whenever we want to ask for repetition, we have to specify that this is me asking this question for repetition. For example, I say, excuse the interpreter, may I ask your client for repetition? Okay, the LAP said something, you couldn't understand, you couldn't hear that. Okay, there was something different going on, but you couldn't catch it. Quite simple. You first of all ask the client. One point is important I have to say here: whenever you do something to the LAP, you have to inform the client. For example, I'm asking the LAP to repeat me something. I couldn't get it. So first I go to the client, I say, excuse me, then excuse interpreter, may I ask your patient, your client for repetition? The client says yes, and then you go ahead and ask the LAP for repetition. Similarly, more examples we have. There's a term I don't know. For example, there's a term used by the client. I couldn't catch it. For example, acupuncture. So I couldn't know that. For example, excuse me, as an interpreter, can you please repeat acupuncture term once again? Could you spell it out for me? Could you clarify it for me? It's quite important that you should understand that what you need. You need a repetition, you need clarification, you need explanation, whatever you need, you should specify it. A lot of interpreters, they have problem. What they have? For example, a sentence is say to them, but they have difficulty with only one term. And they ask the client to repeat a complete statement, which is wrong. So if you have problem with understanding of one word, one term, just ask them. Just ask the client for that term. For example, excuse me, as the interpreter, could you please spell it out? Could you please spell out the term XYZ to me? And you have time while they're spelling it out. You can quickly go to Google and Google it and find some sort of information. So instead of asking them to repeat it, complete statement, you still will have a lot of problems. You will not understand what this term means, because you are understanding your problem is not the statement. Your problem is one specific term. Ask for that. The client says something which is not really clear to you, so do not ask for repetition. Do not ask for repetition. Ask for clarification. Okay? So this interpreter speaking, or excuse the interpreter, could you please clarify it one more time, please? So all the time understand what the problem is. You have statement problem, you need a repetition, you need clarification, you need spell out or spell of something. You need, for example, the description. What is that? So all the time understand what your problem is, and then go ahead and ask the client. And one final point, once again, if you want to say anything, if you want to confirm, ask for repetition, clarification, whatever it is, whenever you want to confirm it with the LAP, first inform the client. And once the client accepts it, then you can go ahead and ask the LAP for repetition, clarification, or whatever you need. Okay, for any profanity, any abusive words that's used toward interpreter or toward the client, as an interpreter, please do not involve. Just simply inform the client that, excuse interpreter, your client is using, for example, profanity or using some wrong words against the interpreter, against the client. How would you like me to proceed? This is a very magical question we ask them. It's quite important. We should know that. How would you like me to proceed? We give the everything to them, the responsibility, whatever they need. We just inform them that what would you like to say. Now, some of the companies have a very different policy. They say whenever the client is using profanity, or if there is something different, so you should immediately inform them that there is profanity, they're using wrong language, and therefore I cannot assist you. But when it comes to BL accounts, Boostlingo, we do not have this permission, and the company doesn't have this permission. So whatever they say, you do not have to involve. Be professional, be formal. Just understand your rule. Your rule is simple: to break the language barrier between the LP and client, and do it as professional as possible, as formal as possible, and that's all you need to do. Okay, sometimes it happens that we have some technological issues, connection problems. So if there is a client who's having internet problem, or their device is quite, sometimes we receive calls like the device is on one corner of the room, and the provider, the doctor, is on the other side of the room, and they're just shouting. The voice has a lot of reflection, so we do not understand what the client says. In such cases, you do not have to panic yourself. You just go and ask them to adjust the device properly so you can hear it properly. It happens there's a background noise, for example, construction is going on, or there's a child who is consistently shouting, crying. So it's quite difficult for the interpreter then to hear it really clearly. At such situations, if you have some technological issues or background noise, you have to ask the client to do something. Excuse me, as an interpreter, I cannot hear you well. Can you check your sound or you can say like, can you adjust the position of your device? Similarly, if it happens to the LEP, once again, if the LEP has problem, first of all, you have to inform the client that there is an ongoing problem. I want to inform the LEP to find a solution for that. Or, excuse me, as an interpreter, I just requested that the speaker check their sound or adjust the position of their device. So it's always recommended if you see some technological issues there, all the time say excuse the interpreter, excuse me as the interpreter, or this is the interpreter speaking. So always specify yourself, specify the problem that what's going on, and also provide a solution. What can be done to resolve the problem? Cultural barrier is another thing that sometimes it happens to us as an interpreter. We have to address it properly, and we have to help them. Remember, it's only for community and medical interpretation, not in any other like legal or insurance. So for community and medical, we can, as an interpreter, we have to be a cultural barrier breaker as well. Okay, so excuse me, as an interpreter, I think there may be a break in communication due to cultural reason. It happens many times for like a diversified community like we have in the United States. So usually it happens that the LPs might have a different belief, might have a different set of culture values. We have to respect them, and as an interpreter we must know about them, because the interpreter's role is not only interpretation but also to understand some culture as well, that what's going on between, okay, the doctors like in the US, what's the culture and what's the culture in their home country back for the LP. So paying attention to this will always help you. If you do not know about the cultures, it will be difficult for you. So I do believe like in some countries the cultures might be different, really different, and in every district and every division the cultures may differ, but it's always really and super important that we pay attention toward it. So if there is a culture barrier, first of all you see like there is an issue going on. Okay, some people like using a different coloring for the children. They want to put like the people, Hindu people, they put like, if I'm not wrong, they put like kind of signs on their forehead between their eyebrows. Or like Muslim community, they are fasting, they are using different colors for their happiness or for their celebration. So if there is something and the provider is asking you and you understand that there is a problem between client and LAP because they do not understand each other's culture properly, in this case you have to intervene and you have to say that there is a culture barrier. You have to explain that to them. So you can say, excuse me, as an interpreter, I think there may be a break in communication due to cultural reason. And the provider may say, yeah, interpreter, what's that? Go ahead. And you have to explain like this is the culture of these people and they do it for the purpose, this purpose of that purpose. Or for example, excuse me, as the interpreter, I just suggested that there may be a break in communication due to a cultural reason. You can use it for the client and also you can use it for the LP. Remember, once again, whatever you do with the LP, firstly inform the client and then go ahead. Okay, we, as an interpreter, receive a lot of different calls. On some calls, when we receive them, so there are people, like they're the clients, they speak for long. The LAPs, they speak for long. And we as an interpreter, we have to guarantee the quality of interpretation, the accuracy. Because we cannot omit anything, we cannot add anything, and we cannot paraphrase even. So we have to say what is said. We have to interpret what is said. If there is someone, whether it's the client or it's the LAP, and they speak for long, you have a protocol to use. Do not panic again. We have interpreters, they take notes for 4 minutes, for 3 minutes, and they think that they can do a lot of challenging job. Okay, it's a good thing that you can do it. It will be really helpful maybe for other types of interpretation, but this is not something you recommended. The recommendation is that we have to be professional. Professional interpreters, they can take a lot of good notes and they can convey the message in a very appropriate way, but the thing is we should not allow the clients in the LP, we have to inform them that they should speak in shorter phrases because we want to guarantee the quality. So you can say, excuse the interpreter, may I ask your client to speak in shorter sentences? This will guarantee the accuracy of interpretation. The LP speaks for a long time and you have to inform the client firstly that there is a problem. The LP speaks for long. So to guarantee the accuracy, the quality of interpretation, may I ask him to speak in short phrases. It also happens that the clients speak for long, So in this case, just you have to bring one change in this statement. Excuse the interpreter, may I ask you? This time we don't say client, okay? If the LAP speaks for long, you can say, may I ask your client to speak in short sentence? We ask the client, okay? But if the client speaks for long, we can say, excuse the interpreter, may I ask you to speak in short sentences? This will guarantee the accuracy of the interpretation. So it's super important you pay attention to word it. Coming next to the topic of hold time policy. Once again, we have call camping. Let me explain what's call camping. CALLCAPMPING. Call camping is supposed to be being for more minutes more than the time of the hold time. For example, the hold time policy of your company says it's like, for example, 10 minutes, but after 10 minutes you're still online, 12 minutes, 15 minutes, 20 minutes, and you just saying the more I'm online, the more money will come to me, I will hit more minutes. This is called call camping, and this is not acceptable. That's why hold time is really important. Once again, I am emphasizing, try to follow the standards. Whatever the company says, you have to go according to that. If you're found guilty, so there's no way to avoid termination, and that will be an immediate termination. Hold time policy is sometimes the doctor says, the nurse says that, interpreter, can you be on hold? I will step out and the nurse will be coming, or the doctor will be coming, the whoever is coming, so please be there, because finding interpreters for some language is quite problematic for them, so they don't want to lose you. So if the time is unspecific, the doctor just stepped out and you are now available with the LP. Once again, I think I have not explained this problem to you. When there is no client in the room, you cannot speak to the LP, and if they try to be speaking to you, that usually they do, so this is called like side conversation, which is not allowed, okay? Or if they ask for the opinion of your opinion, that, interpreter, what do you think, is this doctor really talented? You do not have permission to express your opinions, and you can just simply say that I'm the interpreter speaking and I will be only able to interpret, and I cannot provide any personal beliefs, any personal opinions, any I cannot do any side conversation. So remember, you cannot speak to the LP when the client is not there. The second most important thing is if the time is not specified in the doctor's outside, the client's outside. I should use a general term client instead of doctor, because the client can be anybody. So you can hold for 10 minutes. You can hold for 10 minutes. The time is not specific. Nurse told you, interpreter, can you be on hold? I'm coming back in a few minutes. You can say, yeah, I can be on hold. Now, this hold is for 10 minutes because the nurse did not tell you the exact time. So if the time is not specific, you can wait for 10 minutes. But after 5 minutes, in both languages, you have to use this protocol. Okay, you can be on hold for 10 minutes, 5 minutes complete. Now you have to say, this is the interpreter speaking. I'm continuing to hold as requested and can hold for 5 more minutes. So we can be on hold for 10 minutes, 5 minutes complete, we use it. We use it in English language and also in the LAP's language. You have to say this to the LAP as well. If they start to speak something, do not involve. After 10 minutes, you see that there is no one. Okay, if the nurse comes back, the conversation starts again. That's okay, no problem. But after 10 minutes, if there is no client available, back to room. So you have to say this. The interpreter has waited for full 10 minutes and will now be disconnecting. Thank you. And remember, you have to use the closing time. You have to use at the closing time, you must use the closing statement. This has to be said in both languages, in English and also the LAP's language. This also has to be said in both of the languages. This is for unspecific whole time. But if it happens to, there's a specific whole time, the interpreter will hold for that time. The nurse asks you that, interpreter, please be on hold for 25 minutes. You have to be on hold for 25 minutes. If they ask you to be on hold for 50 minutes, you have to be on hold for 50 minutes. But here is a little, here it is a bit different from the unspecific time. When the time is unspecific, after 5 minutes, we use the protocol. But if the time is specified, like the nurse asks you like to be on hold for 20 minutes, so once 10 minutes complete, you have to say this in both languages. This is the interpreter speaking. I'm continuing to hold at your request. The request was 20 minutes. Okay. If the client has not returned by the stated time, the nurse told you to be on hold for 25 minutes. 10 minutes completed. You use this protocol in both languages. Now, 25 minutes completed. Okay, once again, let me clarify it one more time. 25 minutes, you're asked to be on hold. After 10 minutes, you use this protocol. After 20 minutes, again you use this protocol for both languages. Now 25 minutes complete and the client is not returned to the room. What should we do? We have to say this in both languages. The interpreter has held for the requested time. I will hold for 5 additional minutes. And then I will have to disconnect. It's quite important. Please pay attention to it, because if you do not pay attention, it will be problematic for you. 25 minutes completed. There is no client. Okay. You have to say this in both languages, in English and also in the target language. That I have waited for 25 minutes, the requested time, and I will hold for 5 additional minutes. Again, 5 minutes completed. No one is there. You have to use this protocol in both languages. This is the interpreter speaking. I've held for the requested time and will now disconnect. Thank you for using our services. For example, Portuguese interpreter ID 123 is disconnecting. Okay, drop calls. What is basically drop call? Okay, drop call is like we receive a call and there is no client then. We receive a call and there is no client. Here is something extra I have to give you. Sometimes we receive calls like they are ghost calls. Ghost, ghost call. Ghost call is a kind of call we receive, but there is no one who speaks. And it is connected. The call is connected, but no one speaks. One is drop call. The drop call is when the client speaks to you and you are on the line, but suddenly the client disappears and there is no one on the line. This is called a drop call because the client is not there anymore. We do not get paid for dead time. What is dead time? I have to explain it. When there is no client on the line and we are still there, assuming that we will be paid. No, sorry, you are not paid because there is no client. And this is quite important. That the company pays, the client pays for the services we provide. If client drops, if the English speaking person drops from the call and you're left alone with the LP, this is a very nice scenario. We have LP, we have client, we have interpreter. So now we 3 people are online, but suddenly we see that there is no client. I am here with the LEP, limited English profession, the person who speaks English, the person who is a doctor, the person who is nurse. I mean the client. The client is not anymore with me. What should I do? Ask the limited English proficient for a moment and refresh. Excuse the interpreter, are you on the line? In the line? Wait for client to respond. If there is no response, then advise situation to LEP. And advice for protocol, you can wait for only 5 minutes. If the LP wants to wait, you may hold for 5 minutes. And when time is over, use the protocol. What happens? The LP, the client, the interpreter, we are all on the line, okay? What happens now that the client is disconnected? I'm confirming this now. For example, excuse interpreter, are you on the line? Excuse interpreter, client, are you on the line? This is interpreter speaking. Ma'am, are you on the line? Sir, are you on the line? We see that there is no one. Now I have to come to the LP and I say to the LP in their language that the client is disconnected. I explain it to him or to her. The client is disconnected. I can wait for 5 minutes. Maybe the client connects again or joins us again if you want. If the LP wants to wait for 5 minutes, so please wait for 5 minutes. And then if there is no client, end the call with the protocol. Remember to explain it to the LP. But if the LP says that no, I don't want to wait, so I will disconnect now and I will call back whenever the client wants. That's okay. You do not have to force them to be there for 5 minutes. Okay, so you have to say this. Excuse the interpreter, my protocol is to wait only for 5 minutes. Due to client disconnected, I'll have to drop from the call. Please call back so we can offer our services. Thank you for using our services and have a nice day. So 5 minutes completed, client didn't come. You have to use this protocol to the LAP in the LAP's language. Okay. Keep in mind, anytime that LAP asks you to stay, usually it happens that a lot of the LAPs, they really like to be with one interpreter. They feel comfortable and they really want you to wait for 20 minutes for extra time. Maybe the client comes back. But as protocol, we cannot wait for more than 5 minutes, and we have to inform them that they should call us back, and then we can provide our services. Quite important about this part, you may read everything that you have. If you have any situation in a call which may seem off, an issue like drop calls, ghost call, connection issue, client intake, or etc., please make sure to report immediately on the chat to have a good backup for quality purpose. Remember that the QA department always checks what you did on the call. So be professional. If you did some mistake, if you there was a disconnection issue or any problem that you had and you want to have a backup, always inform your supervisor that it happened to me and this was the call ID. When we receive a call, that we have call ID. Okay, so always you can keep it with yourself and then use it for your reporting, and go to the chat room and report anything that may seem like technical issue, calls that are over 1 hour duration. The reason is that sometimes we receive short calls like 2 minutes or 1 minute. The reason should be found, that what's the reason for the short calls, or if there is a call which is more than an hour, we should know that exactly why this went really long. For example, I say a call was, for example, 95 minutes, so I have to report it that it was a long call, 95 minutes. The patient's cleaning was done, the root canal, the x-ray was done by the dentist, and he scheduled some follow-up appointments. That's why it took, for example, 95 minutes. So you have to mention this. You may take the information from the call rating window. So if you see here, you have the name of the client that we work with. Even when we call the LAP for dial out, so you can see the number is here, the call ID is here, the date, time, and everything is available. Make sure always the client with 5 stars only. Quality should report on the chat room. So remember, this is the rating. This rating shows the upper one, that how this client was. You can rate them from 1 to 5 stars. Okay, you have to rate how they spoke, how they're professional, how. And the second thing is call quality. How was the audio quality or the video quality? You can rate them and just click on rate. As before, we were discussing about, like, it's quite important. If you remember here, I just give you short information about client intake. So this is client intake. Every call doesn't have this. Some calls, when we receive, we will have a specific form like this. You can read it with yourself. So for example, please type in patient's first name. So after I introduce myself, for example, hello, my name is Jose, my ID is 123, I'll be your Portuguese interpreter. Before I help you, may I have the patient's first name, please? You have to ask him for spelling. I can ask like this: may I have the patient's first name with spelling, please? And they will spell it out and write it here. But if it is not provided, you can write NA. Or for example, I say, may I have the patient's last name with spelling? Remember, always, if you're not sure about spelling, you can ask for spelling. Okay, once you ask this question, some calls have like 5 intake questions. Some of them have only 1 question. Some have like 2 questions like this. And then you have to submit. And then you have to say, how may I help you now? Because intake questions are important. And these stars, these asterisks, the red colored, they are important. They say that these questions must be answered. And in some cases, if they do not provide the intake questions, so then you can say, like, this interpreter speaking, if I'm not provided with intake questions, so I will not be assist you. I am sorry for all the inconveniences, because these are like some kind of clients, and whenever the company wants to be paid for the minutes that as an interpreter you served, they may not help them. So these information, all information is important for the record of the finance department and for their decisions. Okay, dial out is a different thing. We haven't spoken about it a lot. So now this is a different case. Right. The client calls you, you introduce yourself, and then the client says that interpreter, I want you to call out to one of my patient. So they want you as an interpreter to call the patient. So whenever you want to dial out, for dialing out, it's quite simple, and just click on this button here. You can see here, this is, you click on here, and a kind of screen like this will be shown. You can choose the code of the country. So always it is +1, which is the US code. You can put the number, which is like 10 digit, and once you have the number, then you can click on here and it will be dialed out. So if you see here, I'm the interpreter here. Okay, it cannot be shown here, so this is the interpreter. Okay, and here is the clinic or the hospital, and this is the LEP. This is the LEP because we are calling. So how many people are there? Okay, there are 3 people: me, interpreter, the hospital, and also the the LEP. Okay, disconnecting the call so I can speak to them and introduce myself. But this is quite important. Let me give this information as well here in this video. If the client asks you to call out to the LEP, you have to ask the questions. These are some questions. Please note it down with you because I cannot write it down. First of all, you should ask them that, may I have the name of the person we will be speaking to? Okay, what is the name of this person? May I have the name of the person we will be speaking to? Once again, write it down with yourself while you're watching this video because it's not available in the protocol, or if it's available, it's quite different. What's the name of the person? Or may I have the name of the person we will be speaking to? And the name is, for example, James. The client tells you. The second question, as an interpreter, you have to ask, may I have the phone number to dial out? May I have the phone number to dial out? You have to write down the number with yourself and then you can put it here. The third question you ask, how would you like to be introduced? How would you like to be introduced? Okay, you have called from Victoria Hospital, but how would you like to be introduced? Your nurse, your doctor, whoever. She says, for example, I'm Christine, I'm the nurse at Victoria Hospital. And you have to note it down because when James answer, you have to say like, hello, I'm the interpreter for Portuguese from Victoria Hospital, for example. Christine has called, she's a nurse and she wants to talk to you. So this will give a very good image because I know a lot of people in the US receive like scam calls and they do not really trust about every call. So you have to give them like a clear picture that I'm not a scam call, I'm someone who wants to help you as an interpreter. These are the 3 questions you ask, but do ask these 2 questions as well. You can say like, in case we reach a voicemail, do you have any message to leave? So sometimes it happens that the person we would like to call out, the LEP, they're not available, but they have a voice, message. They can receive voice messages. So if they're busy, we can keep a voice message. We can keep it there for them. Whenever they're free, they can listen to that. So we ask the client as well, in case we reach a voicemail, do you have anything to leave? Do you have any message to leave? And maybe the client says no. If the client says no, then okay, put the number and dial out. But if the client says yes, interpreter, if we reach a voicemail, tell James that he has an appointment tomorrow at Victoria Hospital at 2 o'clock. And the final question, the 5th question, you should say, is there any callback number? Is there any callback number? The callback number helps the patient, James, if he has any question, he can call back to Victoria Hospital. So you can say, is there any callback number? Usually there is a callback number, but if there is nothing, that's okay. So now what should I do? I put the number here, number of James, I dial it out. In James answer, I introduce myself. Hello, my name is, for example, Jose, I'm Portuguese interpreter, and everything you say will be kept confidential. Please speak directly to each other. And here is Christine from Victoria Hospital. She wants to talk to you. In case James doesn't answer, doesn't pick up the phone, and it goes to voicemail, so it will say, there will be a beep sound and it will say record your message. I will say, hello, my name is Jose, I'm Portuguese interpreter. Here is a nurse, Christine from Victoria Hospital. She wanted to talk to you, but you did not pick the call. And I'm leaving this message. You have an appointment tomorrow at 10 o'clock at Victoria Hospital. If you have any question, please call back to Christine at number XYZ. Okay, for example. And thank you. You have a good time. We end this call and we come back to Victoria Hospital to Christine. I say to Christine, I left a voicemail message with information you provided. Anything else I can help you? And Christine says, no interpreter, thank you, you are wonderful. And you say, thank you for using our services, Portuguese interpreter, or ID number 123 is disconnecting. Here you also have some questions like, remember to verify the information requested below. What is the name of the person you're dialing today? Would you like me to? Even you can use these questions as well as alternative, but I give you 5 questions. What is the name of the person we are dialing out? Okay, sorry. The first question was like, may I have the name of the person we are dialing out? The second question was, may I have the number to dial out? Number 3 was, how would you like to be introduced? Number 4 is, in case we reach a voicemail, do you want to leave any voicemail message? And number 5 is there any callback number? So always put this information with yourself and then go ahead, dial the number out. And that's all for today. Thank you.